Hey everyone, now let's start the aortic dissection. So, firstly, we know the vessels, these are lined by the three layers: tunica intima, which is innermost layer, tunica media, middlemost, and tunica adventitia. Or here we are showing only tunica intima and tunica media. So, this is tunica intima, and this layer is tunica media. So, here, because of tear in tunica intima, which is the innermost layer, the blood starts to pull between the two layers. Here you can see that in pink. I have shown the blood. My red sketch pen was dead. Okay, so that's why I'm showing it in pink. So dissection. This is dissection. So blood starts to pull between the two layers. Now, so the area where the blood collects between tunica intima and media, that's called false lumen. You can see a false lumen has been made, and the true lumen is of vessel, which is literally true. Now the pathogenesis of aortic dissection is pathogenesis of aortic dissection is chronic hypertension, which is a major risk factor. Which now the chronic hypertension is due to stress, the increased blood volume, and coarctation or narrowing. And second is weakened aortic wall. Now the morphology of aortic dissection is intimal tear marking the point of region. External rupture causes massive hemorrhage or results in cardiac tamponade, which is blood backups in pericardial space. And double barreled aorta means dissection re enters the lumen of aorta through a second distal intimal tear. That was about the morphology of aortic dissection. One more point in the morphology of aortic dissection is cystic medial degeneration histologically. So, cystic medial degeneration histologically. Now, types of dissections. Let's see. So, we are having type A and type B dissections. So, let's see firstly type A dissections, which are proximal lesions. It involves ascending aorta with or without descending aorta. So, it's called DeBakay type 1 or type 2. And type B dissections are distal lesions, involves descending aorta, and it is DeBakay type 3. Now here we can see type A and type 2 diagrams. So here this is ascending aorta and this is descending aorta. So both is involved, ascending as well as descending. So it is type A, or only ascending is involved, it's type A, and where only descending is involved, it is type B. Now let's see the symptoms of aortic dissection as sharp chest pains which radiates to back, weak pulse in downstream artery, difference in BP between left arm and right arm.